Hi, I'm Taylor, and this is my favorite hamstring exercise called triple threats. So the first part here, you're going to dig your heels into the ball, squeeze your glutes, and bridge up with your knees bent. Followed by the second part, you're going to bridge up, hold that position as you do a hamstring curl. Really dig your heels into the ball as you drag it towards you, and make sure you keep your hips up. And then followed by the third part is a straight leg bridge. Keep your legs nice and straight, dig your heels in the ball. I usually do about 3 sets of 8 for this exercise. It's actually a superset of 3 different exercises, and it's intended to go in that order. It's intended to target the hamstring muscles, but it also involves the gluteus maximus, gastrocnemius, and the core. The primary muscles at work here are the glutes, hamstring, and core. As I bridge up, I'm digging my feet into the Swiss ball to activate my hamstrings, while squeezing my glutes and core to raise me into a bridge. During the second part, my core and glutes are stabilizing while I flex and extend my knees to perform the hamstring curl. And then for the final part, I keep my legs straight, digging my heels into the ball, and I squeeze my glutes and core to perform a straight leg bridge. During bridging, the glutes are concentrically contracted to take me from a position of hip flexion to hip extension. The core is eccentrically contracted to prevent my back from rounding, and my hamstrings are concentrically contracted during the bent knee bridge and hamstring curls. During the straight leg bridge, my hamstrings are eccentrically contracted to keep my legs from bending. Because of the insertion of the gastrocnemius, a person performing this exercise may feel it in their calf as well. This is because during the bridges and hamstring curls, the gastroc is also assisting in knee flexion. During this part, the tibialis anterior is concentrically contracted to keep my heels down and keep me in a dorsiflex position. So the gastroc could also be eccentrically contracted during the hamstring curls. A lot of people will say that they not only feel it in the hamstring, but at the top of their calf as well, and that is the gastroc. This exercise addresses strength, balance, and stability. Strength because you're using your hamstring muscles and your glutes. Balance and stability because you're having to stabilize yourself in this position especially, but also balance yourself on the ball. This exercise can be modified and increased by exchanging the ball for the TRX, which would further challenge balance and stability. This exercise can be regressed by having the patient put their feet on the ball, dig their heels in, and keeping their bottom down on the table or mat, just digging their heels in and dragging the ball towards them to still activate the hamstrings. But it doesn't involve this bridging portion where you have to stabilize and balance on the ball, but you're still getting to activate the hamstrings. You could even follow that exercise by doing a straight leg bridge. We often have patients do that in the clinic, and we call it a Swiss ball hamstring set, followed by a straight leg bridge on the Swiss ball. The ideal patient population for these triple threats would be a higher functioning patient that doesn't exhibit balance deficits. But again, we can always regress the exercise for someone who does struggle with balance. Ideally, it would be higher functioning patients, especially athletes looking to increase their hamstring strength, and we've even had athletes do this exercise with one leg, single leg, triple threats as well.